February is American Heart Month, which is a time meant to focus on cardiovascular health. All week long, we'll be looking at ways to not only keep your heart in tip-top shape, but also ways to prevent heart disease, all ahead of National Wear Red Day, which is this Friday, February 6th. And here to help us learn more about heart disease and concerns, what to do, what to avoid, we have Dr. Pio Coley. You've got your red on today.
I do, yes, and I'm very excited about Heart Month, Lauren.
Oh, you are ready for it. Awesome.
I'm ready.
Well, I'm excited to learn more about it today. Let's start with heart attacks.
Yeah.
How do you know when you're having one?
So heart attacks are essentially lack of blood flow to the heart. The heart is a muscle that's beating all the time, right? All day, all night, when you're sleeping, when you're exercising, whatever you're doing. So it needs blood flow. So if you get a blockage in the blood vessels that feed blood to the heart and you get damage to the heart muscle, that's a heart attack. So usually, not always, but usually it declares itself with sudden onset of symptoms. So the classic finding is a man saying, I have an elephant sitting on my chest with chest pain kind of radiating to the left arm. That's what you see in the movies. They clutch their left arm and they're having a heart attack. But in real life, 20% of heart attacks, even up to 40%, they say can be silent, or they can have very subtle symptoms, especially in women, where you just feel kind of nauseated, you feel a sense of doom, you feel a flushing, maybe you feel a little lightheaded, sometimes heartburn or excess fatigue. These can all be signs that you're potentially having a heart problem.
So what if there aren't symptoms? What do you do? How do you know that you have heart disease?
So you've got to go looking for it, and that's the whole point of this month. I mean, statistically speaking, heart disease is the most likely thing that's going to happen to you, to me, to every man, to every woman in the US and worldwide. It's the #1 killer, right? And so unless we actually go looking for it, we don't really want to wait for it to declare itself and then react. We want to look for it. And that's where screenings really start to come in. And your doctor can do tests like a calcium score, which is an X-ray of the heart that tells you if you already have some blockages. They can even do fancier tests like stress tests or cardiac MRIs that can also tell you if you already have blockages. But talking to your doctor about your heart risk, everyone over the age of 40, but now we're seeing even people in their late 20s and early 30s need to start thinking about their risk, because the earlier you modify it, the more you can prevent it from ever happening.
Sure, absolutely. And what about a widowmaker heart attack?
This is scary. So a lot of my patients, I'm a cardiologist, they come to me and they say, oh, Doc, I've read about widowmaker. What is it? It makes widows. And that is a heart attack that's one of the deadliest type of heart attacks. It occurs in an artery called the LAD. I call that artery I-25, right? It's like if I-25 shut down, the city would shut down in the same way. Yeah, the LAD supplies so much of the heart muscle that if it shuts down, it can cause a cardiac arrest, it can cause heart failure, lots of problems. So that's the big artery that we have. And again, some of those tests I mentioned, the stress test or a coronary CT angiogram, calcium score, these can all help to identify a blockage in this artery before it even declares itself, before it shuts down.
Is heart disease something that progresses slowly, or does it just happen within a snap of a finger? You know, you're talking about all these age differences now and more people having to worry about it. So I'm just wondering, is it something that you'll notice kind of coming on, or can you do anything to prevent it, like lifestyle changes?
So it progresses slowly, but it starts early. In fact, they have motorcycle victims that they looked at in their 20s. They've already started to put down fatty streaks in their aorta, which is the biggest blood vessel. So starts early, progresses slowly, but can declare itself suddenly. So you could be feeling totally fine, exercising every day, being healthy, and then one day that plaque, that cholesterol deposit inside your artery ruptures or pops, spills into the artery and causes a blood clot that completely shuts down the artery. And that's what you often hear, oh, so-and-so was so healthy, and then all of a sudden they had this big heart attack. So the one that declares itself with kind of progressive symptoms is more rare and happens to older people. The younger ones actually get the plaque popping more. So that's where lifestyle interventions, cholesterol management, blood pressure management can actually stabilize those plaques, prevent new plaques, and even regress a little bit of the plaque that's already there.
Dr. Coley, you have me wanting to take action like right here, right now. What are some things that I can do like today, this week, to help prevent all of this stuff?
Know your numbers, know your risk. So sit down and talk to your doctor about your numbers. Go to the American Heart Association Life's Essential 8 and you calculate your score. And it tells you for doing the 8 things that will prevent 80% of heart attacks and strokes. And really take control of your heart health, because it's in your control. You can prevent 80% of them. You just have to start early.
Yeah, for sure. Oh, well, Dr. Coley, thank you so much for breaking it down, for all of the advice. As always, we appreciate you.